you? Hello. Okay, let's give it one more minute in case people join, and then we can start.
How's the weather in the UK? Did you have a sunny day today? We had a rare sunny day in Zurich.
Oh, beautiful. Yes, it's actually really sunny today. It's a lovely, like, winter, cold winter, but sunny day, which I really love. Much better than the, like, darkness.
Yeah.
Hey,
yes. Carlos.
Hi, Carlos. This is a great idea. For everyone, if you would like to introduce yourself in the chat, please do so. Tell us who you are, where you're from, how you found Dishy, anything that you want to tell us, really. Well, there's a couple more people joining now. All right, okay, I think I'll start kicking things off here. People might be joining every now and again, but that's fine. So welcome everyone to the Stats Methods for Health Equity webinar series. This is our monthly webinar series focusing on statistical and machine learning methods that have the potential to promote health equity. With that, we mean, for example, methods that can shed light on the complex factors underlying inequalities, or fairer algorithms that appropriately take into account the biases that exist in biomedical data sets. This series, as you can see on our slide here, is co-hosted by the Alan Turing Institute, and specifically the Health Equity Interest Group at the Turing, the UCL Statistical Science Department, and also Data Science for Health Equity, which we call DISHI. DISHI is a global community of experts and enthusiasts working at the intersection of data science and health equalities. And our aim is to ensure that the latest research and innovations in data science, machine learning, and AI improve everyone's health, and especially those in underserved populations. And if this sounds anything like things that you are interested in, there are multiple ways to get involved, and I will post all of them in the chat shortly, so just keep an eye out on that, or scan the chat at the end of the talk and you can join us. We do this webinar, we try to do it monthly, and we have amazing speakers always, and today it's my very great pleasure to introduce Wiebke Hutiri. She's actually a very freshly minted doctor, which is really cool, so congrats on that. Wiebke is an applied computer scientist working on Trustworthy AI with a focus on responsible design practices. She works as a research scientist at SonyAI in Zurich, Switzerland, where she focuses on evaluation and benchmarking of AI systems. Her research seeks to address the limitations of AI systems once deployed to anticipate risks, mitigate harms, and ensure that AI technology aligns with societal values. And Wiebke obtained her PhD from the Faculty of Technology, Policy and Management at Delft University of Technology in the Netherlands. She received the Mozilla Technology Fund Award to support her work on fairness in voice technologies, and is a fellow of the Heidelberg Laureate Forum Young Researchers, the Data Science for Social Good Initiative, and Diverse Intelligence Summer Institute. We're very, very happy to have her, and I'm very excited to hear more about her research personally. So without any further ado, I'll let you share your screen. And everyone, welcome Wiebke, please.
Thanks so much. I'll unmute first because the screen sharing is going to take a second. And in case I mess it up, at least I can let you know that I can't see anything. So we try this. Presenter view. Great. Can you see my screen, but not my notes?
Yes, absolutely.
Perfect. Wonderful. Thanks so much. And thanks so much for the invitation, Leandra. I'm really happy to be here. I feel I have to pre-pen my presentation saying that, considering that it's statistical methods for health equity, I'd say this is design methods for statistical methods for health equity. So I like my goal, I think, is quite similar to what you'd be working on. My approach might be slightly different, and because of that, I will spend a fair bit of time contextualizing my research. I also need to say that the work that I'm presenting here is based on my PhD thesis. So it does not have anything to do with the work that I'm doing at SonyAI presently. So I'm speaking here effectively in my personal capacity. Okay, Google, bedroom lights on. 4 years ago, when I started my PhD, I welcomed a set of smart appliances into my apartment so that I could observe and practice how new advances in AI could improve my day-to-day life, with lights that are voice-controlled, doors that open when I get home, without me needing to put down the shopping to find my keys, and thermostats that adjust my heating so that I can be both warm and not broke. At the time, or actually didn't know that presently, some years later, that would become very important. Given where we are today, AI does not need much of an introduction anymore. But because I'm a scientist, I have the right and I think the responsibility to define what I mean when I say AI. Because after all, it's not magic that we talk about. So to me, AI is technological artifacts that are purposefully created to act like humans in order to satisfy our goals and purposes that benefit society, the environment, and other intelligences. Creating artifacts to act like humans can mean many things. I study AI systems that act by perceiving the world with sensors in order to make systems around us, like my apartment, smarter. Of course, the healthcare sector is not unfamiliar with AI and smart systems. So how can AI make systems smart? It starts with digital records of observations about the world, collected by sensors that are embedded in devices, which send data over wireless networks to be processed on cloud servers. Wait a moment, what was that about Google in my bedroom? Yeah, if you thought this is creepy, you're not alone, because by now we all know that the companies that provide cloud servers make billions by using your data to predict your behavioral profile so that they can nudge you to buy things. They then sell the ability to predict your future purchases to advertisers. For healthcare, that's a major problem, and privacy is a big need. Thankfully, not all is lost, because the cloud is not the only place where data can be processed. Let me introduce you to Edge AI. Edge AI shifts AI workloads like machine learning inference from the cloud to localized servers and processors at the edge of the communication network, closer to the data source. Today, Edge AI already runs on billions of devices, on smart speakers, cameras, phones, and watches, and in cars. Edge AI allows us to process data privately, almost instantaneously, and offline. Again, for many healthcare applications, that's important. I could say that the Edge AI dream is the silver lining to the dark side of cloud operators. Except, of course, that when deployed in the world, reality has an unpleasant habit of usurping our daytime dreams of highways without traffic and roads without pedestrians. Unless you tested your AI systems in March 2020, just after the onset of the coronavirus lockdowns, the reality is not so dreamy. And it's not only cars and smart vehicles where we present a dream of what Edge AI might be. In healthcare and wearable technology, that dream is also very present. I see a lot of ads for the fit and the healthy wearing fancy tech gadgets, when in reality, healthcare systems or people really in need of healthcare might look very different and have very different needs. And so, of course, it's unsurprising that AI systems have been creating havoc over the past decade. I have presented this starting point because the perspective from which I approached my research was very much grounded in this Edge AI perspective. And so because of that, it's like, yeah, I guess because of that, there are many aspects of machine learning and AI research that I have not considered in the work that I'm doing. So keep that in mind with the presentation that follows. But if you have a different perspective on it and you think what I've done could be applicable but doesn't quite fit, I'd love to hear that in questions later. And so, of course, a common failure mode that many of us study is the propensity of AI systems to automate decisions that lead to actions that systematically assign undesirable outcomes or deny opportunities to people without reasonable justification. These instances of prejudice, which we call bias, are then something that you are familiar with already. And we've got a growing community of researchers such as yourselves who is working to address them to avoid unfair and discriminatory healthcare systems. Now, if bias in AI is a well-known problem that we have studied for several years, it should surely be easy to apply existing approaches for bias detection and mitigation to edge AI in a rigorous way. Or at least that is what I thought when I started my PhD. But it once again turns out that reality usurps what could and should be, because in practice, a lack of readily available, transferable knowledge on bias detection and mitigation makes it difficult to apply existing approaches to new domains like edge AI, and I expect also at healthcare. That means that despite scientific progress in algorithmic fairness, know-how on how to detect and mitigate bias is not readily available beyond the community of experts that conducts this research. That newcomers to the domain find it difficult to navigate and prioritize algorithmic fairness techniques, and that efforts to detect and mitigate bias in practice can oftentimes be ineffective and sometimes even counterproductive. So this led to my overarching research question: how can we capture established knowledge and practices on bias detection and mitigation from research in algorithmic fairness so that this experience can be reused by practitioners who apply AI in new domains? Why is this important, you might ask? Well, the reason is that bias in technology is rarely an attribute of the technology itself, but much rather a consequence of the social, societal, and technical systems that bring the technology into existence. There's a growing body of work that speaks about bias, feedback loops, and design choices. And I like to visualize it in this figure, starting with maybe cognitive biases that all of us have, whether we like it or not, because it's evolutionary advantageous. The cognitive biases exist in teams that make design choices. The design choices lead to sources of bias, which then get brought into AI systems. However, at the same time, though, the design choices reinforce cognitive biases that people have. They also structure the artificial world that we create, and the artificial world itself reinforces the cognitive biases. Similarly, the artificial world generates data about the world, which again lead to sources of bias that we input into AI systems. And so then it's not surprising that the output of AI systems is prejudice predictions, which can result in harms, unfairness, and discrimination. And where we try to intervene, of course, is in bias mitigation and bias detection, both as interventions and as diagnostic. So where the algorithmic fairness community has really done a lot of really good work has been on the aspects of intervention and diagnostics, so bias mitigation and bias detection. Where my starting point has been on design choices. So choices that developers make within their design, like within the development process and workflows that lead to bias. Prior work in this area has developed documentation artifacts that improve the auditability of AI systems. So data sheets for data sets and model cards are two examples of artifacts that help with the auditability of systems by making design choices transparent. Where I see my work in contrast to that, or I guess, together with that, is that I focus on application-specific design choices in development processes. So back to the research question of saying, how can we capture established knowledge and practices on bias detection and mitigation, which a community of researchers has already discovered, so that this experience can be reused by practitioners who apply AI in new domains. And so this ultimately inspired the development of design patterns for detecting and mitigating bias in edge AI, which I proposed in my thesis. I define a pattern for detecting or mitigating bias in AI as an idea that has been found useful or necessary for detecting or mitigating bias in one practical context, and that is likely to continue being useful or necessary for that purpose in other contexts. I'm not the first person to propose design patterns. The recent history of design patterns can be traced back to architecture, software engineering, business process modeling, and even trustworthy AI. Though prior patterns in this area have been proposed on a very high level and are difficult to translate into concrete design guidelines. Even before this recent use of patterns, patterns have a long tradition of use in mass production, manufacturing, casting, and dressmaking, where they are used as templates that enable repetition and reproduction. The idea is really quite simple, that a pattern should reduce the effort that is required to do work repeatedly and reproducibly. And just as a small matter of interest, if you use the Python programming language, which is considered to be part of the class of object-oriented programming family, that is so object-oriented programming has been quite instrumental in bringing design patterns into the software engineering domain. So just to give you an example that we don't leave things too abstract. So an example of a pattern, and we'll dive into more details later, but a pattern that you're probably familiar with, I call group design. So the kind of detail about the pattern or the ideas is to capture the rationale for choosing attributes that define groups and for deciding when enough different groups have been evaluated. While each pattern captures an individual idea that is necessary or useful for detecting or mitigating bias, a pattern typically cannot offer a complete bias evaluation or intervention on its own. So to do this, patterns need to be used together. This can be done by assembling patterns into collections that guide the developers of AI systems through the process of detecting or mitigating bias. I call these collections recipes because they have many similarities with how we use recipes when cooking, and I'm a great fan of cooking. So recipes specify how bias detection and mitigation processes should be conducted and which ingredients, via patterns, are necessary for doing this. Ingredients can be optional or required. Some ingredients may need to be prepared in a particular way. The order in which patterns are added to a recipe may matter or not. Following a recipe reduces the risk of preparing a meal that is distasteful and maximizes the likelihood of making a delicious meal. New recipes can be invented, but must withstand the test of taste. So I propose two recipes, the benchmark dataset recipe that you see here, and the bias measurement recipe. The processes captured by these recipes guide the curation of benchmark datasets and the quantification of bias, both of which are essential for conducting reliable and repeatable interventions to detect and mitigate bias. So maybe just again, a note is the contribution here is not that I'm proposing something that people in algorithmic fairness don't know. It's rather an approach to codifying knowledge that people in AI algorithmic fairness know, so that people in other domains can use it, reuse it, and also speak about it. So the approach that I followed was in creating these patterns was to reverse engineer bias evaluation software tools. I analyzed source code of the tools, the documentation, and then captured, named, and classified patterns with the help of a conceptual model. In total, I identified 106 pattern instances that resulted in 23 patterns, and as well as two pattern recipes, which I already introduced to capture bias evaluation processes. The tools that I ultimately chose to study in detail were Aquitas, the AI Fairness 360 toolkit, Evaluate, which is a Hugging Face library, FairLearn, and Fairness Indicators. And again, the reason for choosing, to working from the software tools was that it kind of there was an embedded assumption that if somebody had coded, if something existed in code for bias evaluation detection, and if I could find that repeatedly, then it was of high likelihood that somebody had deemed that as a valuable piece of knowledge. The conceptual model divides design patterns firstly into by pattern purpose and secondly by pattern scope. The pattern purpose can either be for analysis or design, whereas the scope would be like dataset patterns, evaluation patterns, interaction patterns, pre-processing, in-processing, and post-processing patterns. So all of those are terms that people within algorithmic fairness have already started classifying their different interventions and detection mechanisms by. And then in terms of how patterns can be used, so I view design patterns and recipes as being useful to use either in a proactive mode, where they are used as a design instruction. So in that sense, it would be taking a pattern and interpreting it as take this action to make progress towards detecting or mitigating bias. Alternatively, a pattern can also be used in a retrospective mode, where it's more of an analysis tool. So there you could use it to ask, has this action been taken? And maybe just to illustrate the difference between the two. So if you, at the beginning of a project and you're creating a benchmark data set, you might want to use design patterns or the benchmark data set recipe in proactive mode, and take the patterns as instructions for how you can design a better benchmark or benchmark data set. Whereas if you are wanting to analyze benchmark data sets that are typically used in a particular domain, then you might want to use the benchmark dataset recipe in retrospective mode to really analyze if the patterns that it specifies have been applied, I guess, sufficiently and satisfactorily in a set of data sets. So my starting point I guess the space in which I validated the design patterns was voice activated edge AI. So back to the speaker systems and the two particular components that I was interested in. The one is called keyword spotting, which is typically your OK Google or Hey Siri. So it's the entry point to the services that Edge AI offers in a voice-enabled ecosystem, and because of that, I felt it was important to study. And the second is speaker verification, which is effectively a type of voice biometrics. So that's using, it's the speaker verification is the face recognition with voice. And I guess to my surprise, I ended up realizing that very limited work had been done on evaluating bias in speaker verification. So that ended up being a really great space to apply a lot of existing knowledge in a domain that hadn't been studied before. So I will now, using speaker verification as a use case, I will demonstrate to you how some of the design patterns can be applied. This is just a brief view of what how a speaker verification system works. So you typically you'd have two utterances. An utterance is a recording of speech. The enrollment utterance is the speech that, let's say, on your phone you would record a piece of voice that gets stored on your phone. Whereas the trial utterance is every time you speak in order to unlock your phone. That is then compared against the enrollment utterance. So that's those are the two aspects of speech that you compare. And so a speaker verification system then extracts features deploys a speaker embedding model, has a function that scores the similarity of the enrollment and trial utterances, then passes its score through a threshold and makes a binary decision to accept two utterances as being from the same speaker, or rejects them as being from different speakers. In the here, as I put, is when I'm going to refer to speaker over the coming slides, I mean the person who is speaking. And the intention of this evaluation was to assess if speaker verification systems, or in particular speaker verification benchmarks, are biased. So using the bias measurement recipe for this, I started with the design pattern that is called consequences of errors. So the consequences of errors pattern states that you should identify the context and application specific risks and consequent harm that a biased model can lead to. And there are three sections that can be evaluated within this. So the types of errors, the taxonomy of risks, and the discussion of consequences. The types of errors in speaker verification systems are false positives, where the consequence of that would be false positive errors ultimately mean that an unauthorized person is granted access to the system, whereas false negative errors imply that somebody who should be granted access is denied access. And typically in speaker verification systems, you've got a trade-off between false positive rates and false negative rates, or false positive errors and false negative errors. Meaning that you can, for example, tune a system, let's say on your phone, to have the same false negative rate for everybody, or a very low false negative rate to improve usability. But that could ultimately mean that some people are exposed to a much greater security risk. Historically, the focus in speaker verification has been on obtaining low false positive rates because the application domain was developed from a perspective of security. So then if we divide the taxonomy of risks, we can start, we can start with the error type, the false positives and the false negatives. The consequences can be that somebody, a mistaken identity, that there's unsolicited data collection, that there's unauthorized access, or that access is denied. The unauthorized unsolicited data collection can happen that if a system, for example, a false positive could also be, let's say, if you have a smart speaker in your home or a voice assistant, it might not be somebody who's trying to intrude into your system. It might, for example, be a TV show running in the background. And if that triggers the smart speaker and passes through through a voice biometric or keyword spotting system, it would basically start sending data to the cloud. And so the risks then that a person is exposed to would be false accusation in the case of a mistaken identity in, for example, a criminal justice application, or identity theft if speaker verification is used for mobile banking. Could be a privacy violation in the case of a voice assistant, like I just explained, or a security breach if speaker verification is used on a mobile phone. Now, if we look at false negative errors where access is denied, in the case of voice assistants, it can lead to quality of service harms. And again, especially, I don't know if this is to what extent people in healthcare really consider this a viable use case, but in the edge AI space, home care and emergency care are, applications, especially for vulnerable and elderly people, are often touted as potential benefits of these systems. So their false negative errors can then really lead to quality of service harms that affect downstream services that aren't just communication or like a chat dialogue. And other areas in which speaker verification is used is, for example, in proof of life verification of pensioners so that they can access their pension, or for workforce monitoring. So in those cases, false negatives and having the access denied can lead to allocation harms. I will skip over the discussion of consequences because the discussion, I guess I have done that now. So it's in bringing the types of errors and the taxonomy of risks together and really thinking through what the consequences might be for a particular application. The next pattern that the recipe suggests would then be is the fairness assumption pattern. So the fairness assumption pattern states that to make assumptions explicit with an upfront statement about that which is believed to make a system fair. And the sections that are included are harms but no errors, AI affordances, fairness considerations, and ultimately a statement of assumptions. So harms but no errors. Again, we've gone through the types of errors that can arise from speaker verification systems, but speaker verification can be used in various different ways. So it can be used in an active or in a passive deployment mode. In active mode, you would, for example, need to specify a specify a passphrase that you can use repeatedly. So that might be something like saying my voice is my password. Whereas passive mode means that speaker verification can run in the background and you might not even be aware of it. So yeah, then it can be deployed with or without consent of the person speaking. and it can advance the interests of the person that's speaking, or it might not. And so, to give an example, if speaker verification is used by a call center agent in passive mode without asking for my consent, and it's used to infer something about my identity, maybe whether I'm a high value shopper or not, based on which I then get demoted in the customer service queue, even if there are no errors, that type of application would never really be considered as fair. AI affordances then is saying, so what do we ultimately want from the technology within the context of an application? So in a criminal justice system, we might say, so we want to use speaker verification because we expect a fair trial. Or we might expect that somebody can execute financial transactions with a reduced effort, or get access to better customer services or greater security. In the case of the proof of life verification, I just think to me, that's a particular stark one. We might say is we want to help elderly people to not need to travel to locations, like to a particular place, to collect their pension. And so it's then within, like, once we start taking all of that together and we say, well, if I'm doing a bias evaluation, I'm starting with some ground truth assumptions. So I'm starting with an assumption and considerations that a speaker consents, that the application is used in alignment with the interests of the speaker. And then only can I say that a consideration for fairness would be that speaker verification should perform equally well for all speakers, which then can translate to meaning that I expect equal base metrics for all users. So again, as with the previous pattern, I won't go into the actual statement of assumptions because I've now talked you through it. But the core idea behind it is that by going through these different steps and thinking through them, that it becomes much more like that. Yeah, it becomes more clear how to adapt and think through a fairness evaluation or a bias evaluation in the context of a use case. And so the last pattern that I'm going to discuss now is the group design pattern, where the framing for that is to capture the rationale for choosing attributes that define groups and for deciding when enough different groups have been evaluated. And the sections for that is firstly to think about theory that supports group formation, to specify group attributes, and then the rationale for group design. So in the evaluation that in which I applied these design patterns, which were in speaker verification, there's a lot of research in speech science that has studied variability in acoustic features of speech and how those relate back to demographic attributes. And so there is theoretical evidence or a theoretical base for looking at demographic attributes within speaker verification performance. Then the actual group attributes that I chose were speaker gender, so male and female, speaker nationality, where there were various that I considered, and then intersectional groups, gender and nationality. And finally, the rationale for group design was that gender and nationality are in many instances protected attributes. I guess gender always, nationality sometimes. But there was prior evidence of gender bias in speaker verification, but that very little research had followed up on that. And then also that there was that was what the metadata had available. And so maybe at this point, I just want to pause is like after going through an analysis like this, there isn't a right and a wrong, there isn't a predictive outcome, but there is, and again we might argue that choosing group attributes purely on available metadata is not the best choice to make. But in stating it up front, it helps to be clear and frank about that, and it makes evaluations comparable and application centric at the end of the day. So yeah, by now I hope that you've gotten a taste of what design patterns are and how they can be used to guide bias evaluation processes when developing AI applications. I want to leave some time open for discussion, so I won't go through all the design patterns, but a lot of future research remains open. So I developed the patterns, as I explained. I developed them from software tools and validated them into use cases in keyword spotting and speaker verification. But as they say, the proof of the pudding is in the eating. And so human evaluation with developers or with practitioners remains an open area of work. Similarly, while I believe that the patterns can be useful to people in other domains, I've actually had a couple of conversations with people in healthcare at TU Delft. So I think that, and like the health wearable space is also one that I guess that I've had an eye on, just because again, like there's very little work done on bias in edge AI and wearables. There are particular things, like particular design choices that get made in the development of on-device and tiny machine learning that may affect performance, but that aren't really studied. And so there is a need to start doing that. So yeah, testing and expanding the patterns in new domains is an open or future area of work. And then developing the patterns into the pattern catalog into a toolkit that is easy to use. That would be, if I have endless time, that will be what I'll do next. Maybe like kind of my best vision of what this could be is that, actually, wait, let me go through that, because I might have written that down. So I want to end with a forward-looking perspective on how design patterns for detecting and mitigating bias can contribute towards a future of responsible AI design practice. And so I see the patterns as a tool that enables alignment on concepts and processes that underlie bias detection and mitigation, which in interdisciplinary teams is really important. I view them as tools that can make bias detection and mitigation repeatable and reliable, which I found, for example, in the speech processing domain often isn't the case. I see them as a tool that reduces the time investment that is necessary to upskill developers in practice on bias, and that enables better collaboration in interdisciplinary teams working on bias detection and mitigation. And so, yeah, I hope that my research elevates the importance of design choices in trustworthy AI development and emphasizes the need to surface and choose between design alternatives while taking societal value into account. And ultimately, what I think we are all after is to is to take these steps so that builders of AI technologies can ensure that AI is built in service of society. And with that, I come to the end of the presentation. I would love to have a discussion, hear your thoughts. Again, as knowing that this is a seminar on statistical methods, I think I've pulled you far into the space of design choices and design thinking. I guess I very firmly hold the view that we need to understand the application context before we can make good choices about statistical methods. But of course, we're researchers, so always open to be challenged on these things.
Well, thank you so much, Wiebke. That was really, really cool. I always love seeing insights from a kind of more conceptual point of view and bringing these views together. And I think you and I have spoken about the value of using the knowledge that we already have from one domain in another domain. And I think this is such a good example of exactly this. And it's funny because I actually just recently finally gave in and installed a smart lamp and a smart plug in my bedroom after resisting a smart home for years due to privacy reasons, but it's just so convenient.
I mean, I think I've decommissioned all the smart appliances in my home. I feel they give marginal gain to my life, but I guess they do in some instances. I'd be curious what you think in a year's time.
Absolutely. So now for everyone, please, if you have any questions, post them in the chat or raise your hand and unmute yourself if you're feeling brave. I can also end the recording here, but I might wait for a bit. But please post your questions in the chat. I will post the call for that in a minute as well. But while we maybe wait for other people's questions, I'm going to be slightly selfish and start with a question of mine. I kind of don't like the questions that are picking out a one thing or a favorite, but if you could pick one thing, what would be your main advice for someone who is building AI systems, someone who is developing methods and really wants to incorporate fair methods or make sure that the method that they're building is unbiased, but they have no idea of all of this literature? What would be the one thing that you could recommend?
Yeah, I would say the key, to me, the key thing would be that design choices made at different stages, from data collection to feature engineering, to model architecture choice, to evaluation metrics, to even bias evaluation metrics, that everywhere along that process, you make choices, and those choices may or may not be appropriate for the application. So if your orientation is towards application, not towards theory, you have to ground your work in having a really good understanding of what the application context might be. And maybe so the reason, one of the reasons why I actually started doing this work is because when I was engaging with practitioners on bias and fairness, I find that people in theory would be keen to do it, but quite often the response that I'd get would be one of, oh, but there's so many fairness metrics, we don't know which one to choose. And it was often also said in a bit of a offhandish way of, if there's so many, then this is not valuable. And then the next thing would normally be is, okay, so we need to invent a fairness metric so that we can measure it. And I always be like, oh, that's not where you should be starting. Maybe start with your data set and this and this and this. So yeah, so maybe that would be my initial response. It's design choices you make everywhere, because data sets are where we start with, I guess. Then if somebody pushed me to narrow down, I'd probably say, think about what data, who's represented in that data, and I guess all the choices around data sets.
That's very good advice. I'll keep that in mind for my own work. I think David had their hand up. David, would you like to ask a question?
Hello. Yes. Thank you very much for the talk. I really enjoyed it. I was just wondering if you had any advice where you have identified that your data set that you're using is biased, and then as you're developing your kind of AI solution, how you should kind of proceed once you know that's the case, whether you should look at mitigating it, but also could you roll out that product with kind of a disclaimer, kind of in these situations there might be issues. Thank you.
Yeah, it's a really great question, because also, I mean, the actual truth is that all data sets will always have some bias. I mean, even there, I also like to say there's an interesting tension between bias and privacy, because in order to be less biased, we need to include more people, but including more people always means giving up, let's say in the case of voice data, there's a lot of personal information contained in your voice. So there's always something of giving up. And there were some of those disasters, for example, where Google went out to capture, they went out to take photos of homeless people because their data set wasn't written. So they are kind of more data isn't necessarily always the answer to biased data sets. And so I think about it in different ways. So the one is that if you are restricting, if your research is restricted to a lab environment, which I think is totally valid, then using biased data sets and knowing the limitations of different biased data sets I think is fair. Where I've seen that go wrong recently is that kind of as more and more disciplines have started adopting deep learning, where deep learning kind of just uses all the data, you've got people from art. So let's say in speaker verification, you'll have maybe 20 data sets that people used to use, and people that have been in the domain for a long time, they know all the nuances and limitations of those data sets. They know a good performance on this data set means this, whereas a good performance on that data set means that, because they know who's in that. But now, as kind of like, as you have a different, new methods being introduced through deep learning, and also new community coming in, you have new community members not always understanding the limitations of data sets. And you've got old community members that understand the limitations of data sets, not always understanding the limits of the new methods. And so there I see, I guess, a lot potentially falling through the cracks. So yeah, to me, I'd say is if you, like, as long as you're in the lab, if you understand the limitations of data sets and where they're biased, and you kind of especially evaluate on multiple data sets. So there's a design pattern, surprise, surprise, called evaluation set, which is about evaluating on multiple evaluation sets, which again is, I feel, statistics people know all these things. I've known them for like 30 years. Not everybody who evaluates machine learning systems knows about those. And then if it comes to applications, I think if the world would do what you suggest, which is just like specify the limits of what something has been tested on, I think we would get really far. And so broadly, I think of that as transparency. And so again, it kind of comes when we start saying, well, trustworthy AI at the end of the day is not only about bias and fairness. And again, I would actually position that without transparency, we're not going to get very far with bias and fairness, because you need to have kind of clarity on those things. And again, I think, yeah, I mean, I would love the world to do what you say. I think in practice, it's a bit more challenging. I sometimes think it's like, let's say no one will buy a phone without looking at the battery life. Well, maybe people will, but a lot of people will look at the battery life of a phone or at the specs of a camera before they buy it. But nobody looks at the training data of the face recognition algorithm or so. And that might not be the best example. But again, especially maybe in more niche devices, in, for example, the healthcare space, I think it would be very relevant to specify for whom products have been tested if they use AI algorithms. A very roundabout answer. And I think it would be really valuable to have more research in this space.
That's amazing. Thanks so much. And thanks for the talk.
Thank you, David. Carlos has also asked a question. I'm just going to read it out, but Carlos, if you want to say anything on top of that, please feel free to unmute yourself. So Carlos has said, thank you. Great to see design practice and AI come together. And their question is, do you have some reflections on how well these patterns apply when using generative AI, such as LLM tools like OpenAI API?
Yeah, I see you. Hello, Carlos. Thanks for videoing in. Yeah, so I haven't used them for LLMs. I have used them for speech generation, which I guess is the parent body of voice cloning and other such fun things. And I found so a couple of things maybe have emerged through that. The one is that I've definitely found more on kind of the sections that I've got in the design patterns rather than the design patterns themselves, that applying them in use cases definitely helps to start understanding, oh, what are the aspects that we would actually want to have covered. So the design patterns that I presented tonight are actually slightly different from the ones in my thesis, which were all about predictive systems. And here I already incorporated some of the thoughts that I had when applying them in generative systems. And so one example maybe would be that kind of this idea of harms without errors was something that I never actually thought about for speaker verification and prediction. But in speech generation and voice cloning, it's very obvious. And so in that sense, I still think it's whether bias measurement and benchmark data sets are the kind of most valuable recipes for generative AI, I think is an open question, Also, whether they're applicable to large language models, I'm not completely sure, but within speech generation, I found them a good starting point to think around bias.
Thank you. Thank you.
Yeah.
I was muted. If anyone has more questions, please feel free to raise your hand or post them in chat. I'm just going to go ahead and ask another question because we still have time and I still want to know more. We just recently had an event, another Dishy event actually, where the journalist and writer Angela Saini was speaking, and she was talking about how a lot of the categorization of data is almost always harmful, and she was basically making a case against disaggregating data. And I was wondering, just because I was thinking about this a lot, what your thoughts are on using categories for fairness, whether you think it's useful, whether you think there is a way of doing it in a non-harmful way, or kind of like what your practical approach is towards that.
Yeah, very good question. And I would almost say is also, if you had asked me what's my favorite pattern, I would have thought I would have been like, oh, I don't really know, but I think group design probably is that pattern. And I mean, the kind of that question, I think there hasn't been anywhere near enough research to think about how we design groups. And I think it's for different, and I mean, what I'll say, maybe as a starting point, group designs doesn't have to be categories. It could, for example, just be minimum performance and maximum performance and what the difference is between those. Where again, and so kind of I think there's a lot of work that should be done in that space to think it through. And I sometimes think, so again, this is me speaking from a perspective of mostly dealing with voice as a modality. Of course, the attributes in the so the acoustic features in that are aspects of voice that can be traced back to demographics. But a lot of the, I guess, I think the kind of historically with a lot of algorithmic fairness techniques coming from the decision-making space, where the data about people would have been the data that's available when it's collected in forms or those kind of things. I don't think it's necessarily the best starting point. And so, for example, something that I've been really curious about is saying, can we, for example, in the speech domain, start rather working on acoustic features and look at bias based on acoustic features, which gives us an idea then, for example, of when attributes of which aspects of the voice make the technology fail. So that's kind of the part one, where I think is we should probably start thinking very differently around how we design groups based on the data modality that we have. But then there is a second component to it, which is one that if we speak about fairness, we do kind of want to, I do think there's merit in saying, well, quite often it's the same people that get hit time and time and time and time again. And so where I do then think that some form of high level categorization, or maybe even just let's say a causal link of saying, well, if it's high pitched voices and slow speech, those would be maybe elderly women, or it would be children with speech deficiencies or something like that. So basically being able to then establish a link again between saying, well, what are the features of the data modality that kind of where the technology fails, but also making it personal again afterwards and saying who will be affected by that. So I used to be super critical of the categories. Now I tend to be more, so again, I tend to think more that we should think about when categories are useful and when not. And so again, maybe in for age, if we look at age and voice data, it's categorizing by decades or something like that isn't particularly useful. But categorizing for 18 to 65-year-olds and 65 plus does become useful, because the voice deteriorates much more rapidly once you hit a particular age. And so, yeah, I definitely think we need much more nuanced work in thinking through when are categories valuable, what alternatives are there to categories, are there ways of connecting alternative categories with kind of like making harm personal, especially to assess if it's the same people that get hit time and time and time again. Yeah, and I think it would be really great if there's more research in that.
Yeah, that's very, very interesting. I think it also really connects to what you were saying before about transparency, really, that and kind of all of your work, that all of the choices that you make in the development process, that you are just transparent about why you make them and with which specific use case in mind. I really think that can already improve quite a lot. That this model is developed for a specific use case, and we make these choices because of that.
Yeah.
And we use these kind of groupings and categorizations because of this specific application.
Yeah, and maybe just to give a specific example, there was a very interesting paper again in the speech recognition space where they did, I think it was an paper from Amazon, so they obviously had like massive amounts of speech data. And they compared two different approaches. The one was one where they kind of looked at bias based on zip codes, and the other one was one where they had this min and max difference. And again, like I really liked the min and max difference approach, and especially if you're applying if you're applying algorithmic fairness techniques to mitigate bias, I guess it makes sense to try reduce that difference as much as possible. But the moment I read zip codes and the papers in the US, but maybe also in many other places in the world, you immediately know it has something to do with race. Or race and socioeconomic status. And so then there kind of comes a question where you say, okay, but it's not just min and max, because the people for whom it doesn't work are also the people that are yeah, so to me that's kind of been a nice paper where I feel like some of it I've been like, yes, that's definitely much more the way we need to be going, this min max, moving away from putting people into buckets. But then at the same time, kind of also this realization of like, flip, but it's the same people that don't get into schools, that don't get social welfare, and that get poor healthcare, that also don't get heard by smart speakers.
This is a very, very interesting conversation. And I would now very cheekily just invite everyone in the chat to join our Slack channel to continue conversations exactly like this. Thank you so much, Wiebke, for this very interesting talk and for the interesting conversation. It was great to have you, and I'll repeat again for everyone in the chat, we have a very lively community at Dishy. Dishy is the Data Science for Health Equity community, and this webinar was part of the statistical methods theme. We have multiple events, actually. We have a reading group where we look at papers specifically and try and understand what we can do from a methods point, what other people are doing, and trying to learn from each other. We also have, well, obviously this webinar series that we're trying to hold monthly. The next installation will probably be in the new year, because it's already quite late. And then we have a landscaping, which is basically a collection of relevant people working in this field, because we're all kind of strewn across different disciplines, and we can really learn quite a lot from each other, as we've seen today. So please join us for events like this. Get involved if you like, and if you just want to lurk and see interesting papers, that's also very, very possible. And with that, actually, thank you all again for coming, for your time, and especially Wiebke for your talk. And we'll speak soon.
Thanks so much, Leandra. Bye, everyone.
Bye.